Hello everyone, myself Preeti Sharma, Assistant Professor in RKGIT Ghaziabad. So, today I will discuss the topic General Principle of Prevention and the Control of Malaria. What is malaria? Its introduction, definition, incubation period, investigation, pathophysiology, sign and symptoms, its treatment, prevention and the precautions. So, today I will discuss all these topics here in the presentations. So, main focus I will give to the prevention and the control of malaria, what is malaria and how we can control it and prevent it. Now, malaria, as all knows, malaria is a mosquito borne febrile disease caused by malaria parasites, and malaria, the word here mala means bad and area means air, is a protozoal infection, a disease caused by a member of protozoa genes Plasmodium, a widespread group of sporozoans. That parasite affect the human liver and red blood cells. Humans are infected with the Plasmodium protozoa when bitten by an infective female Anopheles mosquito vector. There are 4 species of malaria parasites. First one is Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale and Plasmodium malaria. This is the species, 4 species of malaria parasites. As I told you that malaria is a mosquito borne febrile disease caused by the parasites. These are some species which is caused the Plasmodium falciparum. These are the parasites, 4 species of malaria parasite. Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale and Plasmodium malaria. Malaria found in about 100 countries in the world. Maximum prevalence of malaria is found in warm and humid environment and mostly seen in July to November in India. Now, the optimum temperature and humidity for the development parasite is 20 to 30 degree Fahrenheit and about 60% humidity. Means for the development of this parasite we need the temperature and the humidity. Humidity is 60%, means 60% humidity is required for the development of this parasites, and 20 to 30 degree Fahrenheit temperature is required, optimal temperature is required for the development of this of the 4 species of malaria parasite, and it is basically found in 100 countries in the world. Maximum this prevalence can be seen in the warm and humid area, mostly seen in the month of July to November. Now, you can see here the life cycle of the malaria. First one is bite from an infected mosquito. If a person bite with the bite from the infected mosquito, then parasites start reproducing in the liver. Some parasites remain dormant for the years before becoming activated. Means after infecting the mosquito, when the mosquito bite this patients, this parasite start to reproduce in the liver. This parasite reproduce in the liver. You can see here that in the first stage you can see that the mosquito bite this patients, and in the second this parasite will move into the liver and it will remain in the dormant stage for years and before becoming activated. Means in the dormant state it will remain here in for many years, and before becoming activated, before activating it will remain as a dormant stage, it will remain in the dormant stage. And next is in the third step, you can see here in the blood stream further reproduction occur within the RBC. In the blood stream here you can see there is a reproductions. You can see here there will be a reproduction occur within the RBCs. RBC will reproduce here in the blood stream, and in the fourth case you can see parasite reproduction result in further red blood cell infections. Here the parasite reproductions means this in the third case you can see here that RBCs is reproduced. So, after reproducing the RBC, it will in the blood stream it will cause the infections. RBC cell infection can be caused by reproducing this of the, we can say the parasite is reproduced, that is why there is a RBC infection occur. Now, in the next stage you can come here in the fourth stage. This is a fourth stage, you can see here this is a cell infection, and in the fifth stage cycle of RBC infection and destruction of the RBCs. After the infection of red blood cells, means after the fourth stage after the fourth stage, when the parasite reproductions result in further RBC cells infections, it will move to the RBC rupture, means in the fifth stage the RBC will rupture or destruction of RBC will occur. Then there will be a sign and symptoms will be seen in the patients like chill, fever, and all this we can say symptoms can be seen in the fifth stage when the RBC ruptured after the infection. And this next and the last one is dormant version of the parasite are ingested by the another parasites. This as I told you that many of the parasites will remain in the dormant stage. In the second stage I told you in the liver that parasites will remain in the dormant stage. Some of the dormant version of the parasites are ingested by the another parasites, means it is if the another mosquito will bite the same person, it will taken by the means it will taken by that mosquito, that dormant parasite will be dormant version will be ingested by the another parasites. So, this is a whole stage or the whole life cycle of the malaria. Now, the investigation, or we can say how we can diagnose the malaria. All clinical suspected malaria cases require laboratory examinations and confirmations. Here the history collection, physical examination, malaria parasite test, and the peripheral smear and the bone marrow smear, CPC, TC and DC. This is a CPC means and we can say complete blood count, TC means total count, and DC means differential count of WBC. And these are some investigation how we can investigate or how we can diagnose the malaria. Historical collection, physically we can examine the malaria patient. Malaria parasite test we are doing, peripheral smear, bone marrow smear. By taking the bone marrow smear, we can in the laboratory we can examine and confirm the this malaria on the basis of the report. Differential diagnosis of uncomplicated malaria means the differential diagnosis means differential count, WBC count of the uncomplicated malaria considered other illness such as upper respiratory tract infections, tonsillitis, ear infection, pneumonia, measles, dengue, influenza and typhoid fever. These are the upper respiratory tract sign and symptoms which is seen in the patients. Remember that the patient may be suffering from more than one illness, considered another illness such as here I told you that dengue fever, tuberculosis, hypoglycemia, meningitis, these are the sign and symptoms which can be seen in the uncomplicated malaria. If the patient is suffering from the uncomplicated malaria, then these are some sign and symptoms which can be seen in the patient. Now, here some of the events in humans start with the bite of mosquito. Man intermediate host, mosquito definite host, and the sporozoite are infective forms, means the host for is man and the mosquito. For the malaria, here the definite host is the mosquito, and the man, for the man intermediate host, these are two hosts. For this, sporozoites are infective forms present in the salivary glands of female Anopheles mosquito. After a bite of infected mosquito, sporozoites are introduced into the blood circulations. Now, this is a cycle of mosquito when bite, how the sporozoites and gametocytes form. When the infected mosquito inject the with the sporozoites, sporozoid migrates to the liver where they form the merozoites, and these merozoites are released into the RBCs, and the RBCs, in the RBCs the merozoites is converted or become into the tropozoid. In the tropozoid is also, in the RBC the tropozoid also have a multiple producing new merozoites, and they are released when the RBC ruptured and infect the other RBCs. Some merozoites become gametocytes, and in the female Anopheles mosquito, to pick up the gametocytes from an infected human, this sexual cycle occur in the mosquito where sporozoites are formed. So, you can see here in the diagram, the main cycle is given here. This is a structure of malaria parasite. You can see here this structure of parasites. RBC, here you can see the parasites, this RBC cell membrane channel, this is RBC, this is a parasite. Here the channel of RBC where there is a movement of the ions will took place. Now, here the PVM channel, here the parasite, this plasma membrane transporters, you can see here the transporters, parasite plasma membrane transporters, and you can see here the channels, PVM channels and RBC membrane channel. You can see these three channels in the parasite structure, and here you can see the broad structure, or we can say this the various here shown the structure of the parasites. You have to remember the main structure of the parasites. It is given the broad of this structure. Now, these are some sign and symptoms of the malaria. So, first one is centrally we can see the sign and symptom of the malaria is headache, systemic is fever, muscular fatigue and pain. In the back you can also feel the pain in the malaria, and in the skin you can see the chill and the sweating, chill and sweating can be seen, and you can see here the respiratory dry cough in the spleen, enlargement of the spleen, stomach, nausea and the vomiting. These are some important signs and symptoms according to your organ means the various body parts, you can see the various sign and symptoms. High fever with headache, restlessness, anorexia and diarrhea, joint pain, vomiting, anemia, chill and the rigors, chill with rigors, convulsions and the coma. Typically, we can see the paroxysmal attack of malaria fever found in the 3 stage. First stage is the cold stage, second is hot stage and third is sweating stage. This is when the person typically attack of malaria fever, you can see this 3 stages, cold, hot and sweating stage. Now, how we will focus here in the malaria management, how we can manage or how we can control and prevent the malaria. Now, the management of malaria includes following measures: early detection and early treatment, mosquito control measures, community, means we have to detect the malaria in the early stage. The early stage, then we can prevent and control the malaria if we can detect it in the earlier stage. As I told you, the life cycle of the this in the previous slide, see here, sorry, here the various stages I told you. So, in the early stage, if we detect this malaria, then we can control it or prevent it. Suppose if we detected in this stage only, in the third stage if we detected, then it is easier to prevent this malaria. If we are going at the last stage, then it is very difficult to control it. So, in the this I told you early detection and early treatment is very important. Mosquito control measures, how we can control the mosquitoes after for the biting of the infected mosquito, sporozoids introduced into the bloodstream. Early detections, early detection of fever cases in the community by house to house visit by the health workers in every 15 days. Early administration of anti-malarial drugs like chloroquinol, chloroquinines, and to all the fever collection of blood films, thick and the thin, from fever cases in laboratory examinations for malaria parasites, and administration of medical treatment to all the positive cases of malaria. Means first is chloroquine. If chloroquine is given to the, means anti-malarial drug is given to the patient, then we can control it or we can prevent it. 150 mg base per tablet we are giving the chloroquine, then we can prevent it. Or we can if we are giving for the 3 days, then 25 mg base per kg divided over the 3 days. This dose is divided for the 3 days, 25 mg base per kg, and if we divided the 3 days, day 1, 2 and 3, suppose if we divided here, I am going to tell you how we are dividing this chloroquine. For day 1, for day 1, for day 2 and for day 3, if we are giving this chloroquine, then we have to give a different dose, means 10 mg, 10 mg we are giving at day 1 per base, 10 mg per base per kg, we are giving at the starting days. At the starting days we are giving the chloroquine 10 mg per base per kg in the starting days we are giving, and when we can see there is 2 to 3 days happen for the 10 mg we have given, after 2 to 3 days we can give 5 mg, it will reduce to 5 mg per base per kg we can give to a person. Now, the next one in the day 2 we are giving the 5 mg. 5 mg we are giving the at day 2, and in day 3 we are giving the same dose, that is 5 mg. Now, these are some mosquito measures. First one is anti-adult measures, DTT spraying, anti-larval measures, larvicidal operations, and the next one is protection against the mosquito bite. We are using the mosquito nets and repellent creams we are using to prevent from the mosquito bite. Now, these are some methods of control: removing or poisoning the breeding grounds of the mosquito, or the adequate aquatic habitats for the larva stage. For example, by filling or applying the oil to places with standing water, spraying with the DTT. Early management and decisions should be given to on the basis of various surveys, and monitoring and evaluation the drug and insecticide resistant monitoring means we are controlling by using the mosquito net. You can see here the mosquito net. By using the mosquito net we can control or prevent one of the most important physical we can say to prevent the malaria, prevention of malaria with the help of using the mosquito net. So, it will prevent from biting of mosquito. And next one is use insect repellent. You can see here the insect repellents or various as I told you that by spraying the DTT on where the standing water is there or where there is an excess of water, we can spray the DTT. Next is by closing the windows. We have to close the windows so mosquito will not enter into the rooms. So, it will prevent us from the bite of the mosquito. Another one is risk of getting bitten reduce, means risk of bitten reduce, getting bitten reduce. These are the parameters or these are some points you have to remember. First, use the mosquito net, use insect repellents, close the windows, and risk of getting the bitten reduce. These are some, these sum is equal to the risk of getting bitten reduce, means bitten will reduce by using this 3 of them. If we are using this 3 of them, then we can control or prevent the malaria. Means you can see here the 3 sum is equal to the risk of bitten reduce. And here I told you that mosquito measures should be used. Anti-adult measures is DTT spraying. We can spray the DTT. Larvicidal, anti-larval we can measures be the larvicidal operations and protect against the mosquito from the bite by, as I told you, that mosquito net repellents or creams we can use for the mosquito measures. So, we have to focus on all these parameters. And one of the important early detection parameter I told you that anti-malaria, means chloroquines, different mg of chloroquines, 10 mg initial days. For day 1 we are giving 10 mg, on the second day is 5 mg, and on the third day we are giving the 5 mg base per kg. In the starting days we are giving the 10 mg. Now, I told you this some of the control method here: removing or poisoning the breeding grounds of the mosquito or the aquatic habitat of the larval stage, and we can prevent the bite of the mosquito by using the repellents, creams, mosquito net, And by closing the window, early management is also important parameter for controlling this methods, and monitoring and evaluation of drug and insecticide resistance. These are some important points. So, you have to remember, first is mosquito net, insect repellents, these all are equal to the risk of reducing the bite. National Malaria Eradication Program, government launches this eradication program in 1953, administrating the anti-malarial drug chloroquine, as I told you, in the 10 mg per kg for 3 days, and 25 mg pyrimethamine with 500 mg sulfadoxine. For the prevention, we can use 25 mg pyrimethamine. So, you can control and prevent this malaria. These are some references here. So, you have to note down these references and the review papers from which I have taken, and thank you for your patience.